Hi, Ben Chateau here, physical therapist from the Physical Therapy Advisor. I wanted to talk to you today about elbow pain and how to use cupping to treat elbow pain, elbow tendinitis, tennis elbow. And what we do is we use, you can buy these online. I'll have a link to my resource page where you can order these from Amazon. And it's just a silicone cup that we can squeeze. We can apply some suction force to the area that's bothering us. And I use it in several different ways. First thing I do is I'll put that on there, and I want to move the tissue back and forth. Not hard, not aggressive, but just nice and easy, finding that tightness, finding that restriction, just trying to loosen it up. We can go right over the point of pain, but we don't want to just go over the point of pain. We want to work down the entire structure here, the extensors here of the wrist. And we're going to go in all the different directions. If I find a direction that tends to be a little tighter, just feels like it needs a little more work, I'll work it. Once we go all the way down, I'll come back, usually right around the injury site or the site of pain, and I'm going to use my wrist to move the muscle back and forth. I'm going to start with it close to my body. I'm going to go back and forth like this, extending and flexing the wrist. I'm going to extend my elbow, making sure I keep that pressure there and I'm not losing my suction force. And I'm going to extend and flex. If you lose your suction, just regather it there and just keep going. We do about 20 reps depending on how it feels. If you don't have one of the fancy cups, you can get these. They're little sink plungers. They're a little harder to deal with on the arm because of size. Maybe might need someone to help you, but you get the suction on there. Hold that over the area and we'll do the same thing. You can flex and extend, you can move the tissue, just trying to mobilize that. Don't go too aggressive, don't go too long. We don't need to cause a lot of bruising or discoloration of the skin for this to be effective. I tend to do maybe up to 2 minutes of mobilization at one time. You don't really need to go more than that. And again, you don't need to just keep that suction over that spot for long periods of time, causing discoloration or bruising. That's not going to be necessarily more effective. Just work through the course of the extensor tendons there with the cup or the plunger. For more tips and strategies on how to self-treat common related injuries and pains, please subscribe to my YouTube channel or go over to my website, thephysicaltherapyadvisor.com, and check us out on Facebook, The Physical Therapy Advisor. Thank you.